SimplyHome, we support provider agencies, caregivers, and self-advocates through designing and installing innovative and affordable technology solutions that lead to greater independence and self-determination for individuals with disabilities and seniors looking to age in place. Our technology empowers individuals while addressing the concerns of caregivers. SimplyHome's technology can adapt over time to support independent living skills while alleviating concerns about cooking safety, medication adherence, and the risk of wandering or falls. Caregivers are notified only when they are needed, prompting the highest level of independence possible for the individual. Today, we are going to take a tour of our demo apartment to learn more about how enabling technology can empower you.
Hi, I'm Jason Ray, President of SimplyHome, and thank you for joining us for this virtual tour today. We're going to talk some about our SimplyHome system and other enabling technologies to help individuals live to their maximum level of independence. We're going to do that by telling some stories of some different individuals that we serve, as well as highlighting some various technologies that go into creating those solutions. So we're going to start here in our kitchen, and what you'll notice is a few pieces of just normal things that everyone would have in their kitchen, like a stovetop, an oven, a refrigerator. It may look a little different in our demo apartment, but you get the idea. So as we're looking to support someone who may need assistance cooking, we can do that in a number of ways. For some individuals, it may be that we want to know when they start cooking, because maybe they need some support right when that happens. And as Emily spoke to earlier, there are ways that we can notify remote caregivers through email, text message, phone call when those kinds of things happen. But oftentimes we also just need to help support that individual directly instead of alerting somebody supporting them remotely. So we can do that in a number of ways as well. It could be through an audible prompt or cue, could be through something like a light flashing or a strobe light going off as a reminder, and we'll see how that works right now. So this is a induction cooktop, and when this turns on, our system's actually going to detect that, and then we can do something with that information. So again, those somethings could be a reminder to that individual, could be an alert to a remote care team member, a lot of different things. So we're going to start just by turning that on, and what you'll note is that we had a light start flashing up here. You'll also note that this iPad is going to receive a notification right now. So it can be a combination of those things as well. So it could be that we need to provide some kind of cue or prompt to that person. It could have also been audible, where it was a reminder for me to do something once we detected that. We could also control other things in the house. So again, it could be flashing another kind of light or some kind of activity like that. Additionally, there are lots of other things that could be coordinated with that. So it may not be that you want to have a notification or a reminder or controlling something right when somebody starts cooking, but maybe we need to pair that with something like a motion sensor in the kitchen. So if an individual starts cooking and they're not active in the kitchen for a period of time, maybe that is what you want to provide a reminder about, or alert someone about, or control something about. So there's lots of different ways that these kinds of things can be structured, all based on that individual's need. So thinking person-centered and not technology-centered, we want to understand what are the true concerns for that person so that we can fit not only the right technology, but the right outcomes for each person supported. Moving on to some other things in the kitchen environment, so it could just be access to food is a concern. So when a refrigerator opens, when a pantry opens, when a certain cabinet opens, access to medication can be supported in a similar way, so that someone open a medication cabinet, those kinds of things. Additionally, things that we'll look at from a safety perspective in a minute, things like, did a smoke detector go off? Could just be that somebody left a pizza in the oven for a little too long and started to smoke a little bit or whatever. But being equipped with that information when you're not physically present can really make a difference in someone being successful independently and not. So we're going to move on to some other areas of the home now and see how technology can play a role in other facets of life. So sensors can be used throughout the home to support a lot of different activities of daily living. We're going to talk in a second about some things like a sensor in the bed, but also want to remind everyone that sensors can be placed on things like exterior doors, again, motion sensors throughout the home, water sensors in bathrooms. Again, the idea of knowing that something has happened or not happened in a home so that we can maybe alert a remote care team. So as a provider organization, if you have paid supports available to respond to an individual based on a need detected by the technology, when that activity happens, somebody gets out of bed in the middle of the night, they leave the house, water is detected in the bathroom, you can respond immediately before that issue becomes a bigger problem. But in the context of a bedroom situation, we often want to know, is someone in or out of bed? Have they been out of bed for an extended period of time? Or sometimes it's for convenience as well for that individual to help them control items around their house. So maybe it is the nighttime, they get out of bed to go to the bathroom. It would be really nice to go ahead and turn the bathroom light on for them. Or when they get back into bed, to turn that light off so they're not having to find a lamp switch. Maybe they don't have the physical dexterity to operate a lamp switch. So there's automatic ways to provide that kind of control through a home as well. So it doesn't just have to be about alerting someone. Maybe we want to help remind someone to get up in the morning. So if they have a tendency to hit their snooze bar a few times and not get out of bed, we can have a sensor in their bed to know that they have gotten out of bed or not. And on those mornings that they do hit the snooze bar a few times, now the technology can provide a reminder directly to that person to help ensure that they're getting up on time and being successful for the day. So let's see how that works. So again, this is going to be, say it's nighttime, I've just gotten back into bed, and now it's going to automatically turn the light off for me. So I don't have to, again, try and reach over and do that. And the same thing could happen when I get up. So again, it's nighttime, I've gotten out of bed, maybe I need to go to the restroom, that light could automatically be turned on for me. Additionally, we could look at ways to then know that other things have happened or not happened throughout the home as well, based on that activity of someone getting up. But when we start talking about environmental controls as well, so things like turning a light on or off, it doesn't have to be based on actions detected from other sensors. Oftentimes what we find is that individuals may not have the ability, or their preferences may be such that consumer-based smart home kinds of technologies aren't accessible for them. So think about a smart thermostat. Anyone who's used that technology knows that it is fantastic in a lot of ways, but if you try to set it up, interact with it in a lot of cases, it takes a lot of dexterity, it takes an ability to read. There's a lot of things that for a number of people that we support makes that kind of technology not accessible. So one of the things that we also focus on is making sure that we can provide things like an iPad interface or adaptive switches or things like that based on that client's preferences and abilities to allow them to access those kinds of technologies. So if we have an individual who doesn't have great dexterity but still wants to operate a smart thermostat, maybe we just have 4 really big buttons on the screen to allow them to choose increase my temperature, decrease my temperature, turn a light on, those kinds of things. Maybe we have an individual who doesn't have the ability to read, so we need to use icons that are familiar to them from their home, or colors or other things like that. So that's where we want to, again, understand what's going to be the best fit from a person-centered approach for that person to make sure that we can provide an interface that's going to be effective for them in whatever shape or form that may be.
So I'd like to share with you some of our health and safety technology solutions. One of them is this medication dispenser. As you see here, the medication dispenser can be locked, so therefore a caregiver or a staff member is able to fill the medication and keep the medicine locked. Once it's time for somebody to take their medication, this device will send an alarm. It'll make an audible alarm and light up, notifying the person to take their medicine. If they still don't take the medicine in a set amount of time, then the device is able to call, email, or text that individual, reminding them to take the medicine, or notify a caregiver or a staff member that the medicine has not been taken. This young man here, Dakota, used our medication dispenser, and after a few months, of being successful with our medication dispenser after we were able to look at the data and see that he was taking his medicine on time. He didn't need this device anymore, and now he just receives text messages when it's time to take his medicine. Another feature that we have that supports one's safety in their home is the PERS system. You might be familiar with the PERS pendant, and oftentimes this may not work for everybody. Therefore, we have the ability to have a personal emergency button on a switch. We can put these on a bedside, on a wall, somewhere where they'll be accessible for someone in case of an emergency. Now, with our PERS, we understand that people that we support might not need the ambulance or medical professionals to be notified. They might just need their support staff immediately. And so with the PERS, we're able to connect this directly to the support team that can get notification and then determine if emergency help is needed.
So next we're going to talk about some different tools available for communication and check-in for supporting individuals either in person or remotely. We're going to start talking about the Nucleus Care device. The Nucleus Care device is a fantastic tool that will provide both audio and visual communication that is secure and really simple. So think FaceTime, but again, secure and really, really simple, one button operation. It's a dedicated application on this device. So there's no other apps to go to or things to open. It is really, really simple. As you can see on this main screen, there's really just one big button to press. So if somebody needs some support, they just press this big button at the bottom. We have it set here to call SimplyHome. If you press that button, it's going to alert whoever you have defined on that person's support team. Could be one person, could be a team of people. They're all going to get notified. Whoever's available can pick that call up and provide that support. The other thing to note is you don't have to use the video function. So if privacy is a concern, you don't have to activate that. You could have audio only. The device has a manual shutter on the top, so if there's a concern about privacy, you can completely shut that off and make that not accessible for anyone. So again, from a privacy perspective, some really great tools there. It is a HIPAA compliant solution. And there's some great tools from a provider perspective to allow you to manage this type of technology for a number of people. So through their mobile application, through their back-end website, you can see the status of all the Nucleus Care devices. You can open up an audio or audio-visual session with an individual through the mobile app, through the back-end web portal on something like a laptop. So there's some really great tools also for reporting. So if you need to go back and look at history, who made a call, how long did that call last, all of those things are available through the web portal as well. Some other handy features on the device, we talked about the ability to engage many people, so it doesn't have to be paid support, it could also be family. So if you want to give family an opportunity to communicate to an individual, so in a time like now where COVID is a concern and you don't want a lot of people coming and going from a home, it could be a great opportunity to still have that interaction. It's, again, super simple. When you set up a new family member, they have to take a picture so that you have that association, and makes it really, really easy. One button press, just like on the first screen, you hit that and it's going to call that person directly, and now you have that audio or audio-visual communication. You can also turn this into, through the memory box, like a virtual picture frame, where you can upload pictures to the device and that individual can see those and they'll just play on the screen when it's not being used. And then finally, you have the ability to deliver messages that could be reminders, or maybe you want to do a wellness check and just see how someone's doing for the day. So if I needed a medication reminder in the morning and I wanted to deliver that through the screen, not only is it going to come to the screen, but it can be read to me as well. So I don't have to be able to read it, it can be read to me. Same thing with a wellness check. So if we want to check in on someone, see how they're doing, that can be really customized, it can be read to me. It could be based on a thumbs up, thumbs down kind of response, could be on a rating scale. There's lots of different ways, again, thinking from a person-centered perspective, to make sure that this kind of technology is accessible for as many people as possible. So we're going to finish our tour today by going and looking at some other safety aspects and also some convenience aspects around access to the home. One area of the home that is a common area of concern, particularly for family and caregivers, is the exterior of the home. From a safety perspective, knowing who's coming and going, making sure that the home is secure. So as individuals gain more independence, just ensuring that all of those things have the proper supervision, have the proper levels of accessibility for the individual can be really important to their long-term success. So Sophia is an individual that we support. She actually lived with her brother in an apartment, and they had this same kind of concern, around her safety. There was a number of situations where she would get locked out of the apartment because she would forget to take her keys with her, or she would leave, forget to take her keys, and her brother was already gone, and now she accidentally left the apartment unlocked. So some really simple tools that were really effective for her was just like a smart lock, right? And the great thing about a smart lock is it works just like a regular door lock. You can put a key in, turn it, do your thing. But if you forget your keys, a really simple keypad on the front with a 4-digit PIN code will unlock that for you so that you can access the home. Just like a lot of other things we've already talked about from a control standpoint, it could be based on a client's choice like we just saw, but it could also be controlled automatically. So through our SimplyHome system, if you need the ability to, let's say, automatically lock the door at a certain time of day, or when the system detects nobody is active around the home, those things could be done automatic as well. And finally, I want to talk about a video doorbell. So this is a Ring video doorbell. And the great thing about the Ring video doorbell is that it can connect both an individual and their care team to who's coming and going from the home. So we have a number of individuals where this is simply just giving both an alert and a mechanism for that individual to interact with the person at the door without having to open the door first. So through a smartphone or a tablet inside, someone comes to the door, that individual gets a notification, they can go to that device, see who's at the door, even talk back and forth with them before, again, opening the door and making sure that it's a safe thing to do before they go and do that. At the same time, a remote support team, family, paid support, whoever that is, can be notified that someone's at the door, and they can check in and make sure that that is appropriate as well. There's a number of other options with Ring. It doesn't just have to be a doorbell, it could be things like floodlight cameras and other things like that to ensure that an individual or their care team knows what's going on in a lot of different places around the home. Additionally, we also often install things like just regular door sensors on exterior doors and windows, so that at an odd hour of the day, 2 o'clock in the morning, a door opens, maybe that's concerning, an alert team can automatically be notified, and they can follow up right now to address that situation and see what's going on. So just some really helpful tools, again, to help make sure that things are being done safely, being done properly, but still providing great tools for access for individuals when it's needed and when it's appropriate.
We hope you enjoyed the tour of our demo apartment and learning more about SimplyHome products and services. To learn more information, as an organization, if you'd like to set up a webinar, or if you're a self-advocate or a caregiver ready to get started with an intake for enabling technology, go to our website, www.simply-home.com, and click on the Get in Touch tab. And remember, we're on this journey together, you, me, and technology.